Thank you so much, Katrina. Can I check that you can see me and that you can hear me? Is that a thumbs up? Wonderful, or two thumbs up? Wunderbar. I absolutely love the work that Katrina and the people at UCL Unit for Stigma Research do. In my humble opinion, your hearts and your minds are in the right place, and you have my full support. So thank you for blazing trails in your wake, and let's dive in, shall we? So absolutely honored to contribute to this event, and thank you for providing me with a platform to amplify the voices of experts by experience, survivors, people with lived experience or living experience of a mental health condition, psychological problems. It's a personal choice, the words that we use to describe ourselves. So the aims of this presentation, I'm going to highlight the epidemic of psychological problems in healthcare professionals and students, and discuss and describe the role that experts by personal and professional experience, and we coined this acronym, this mnemonic EPPE, to denote expert by personal and professional experience, and also known as wounded healers. So discuss and describe the role that EPPEs, also known as wounded healers, play at reducing mental health related stigma, and present data from a pilot study. And I understand it's the first study of its kind on an anti-stigma program comprised of healthcare professionals who themselves have recovered from a mental health condition, psychological problem. Right. It's true. Doctors are human too. So I don't know about you, but my mental health took a real battering during the pandemic, and I know that Professor Greenberg from the IOPPN graced us with his presence in this meeting, and I'm sure that he touched upon phenomena such as moral injury and compassion fatigue and emotional exhaustion and burnout. And I will refer to his paper. He and his team recruited 709 healthcare workers from ICUs across England, and they were invited to complete this online web-based survey. And it revealed that 45% met the threshold for at least one of the following diagnosable conditions: PTSD, severe depression, severe anxiety, and problem drinking. And 13% reported frequent thoughts of being better off dead or of hurting themselves in the past 2 weeks. Now, this is a systematic review of physician suicide, showing that the suicide rates among physicians is 28 to 40 per 100,000, which is more than double that in the general population. Now, there are three broad approaches to mental health. So there's proactive. So prevention is better than intervention, or prevention is better than cure. However, I know that Katrina alluded to Adam Kay's book, This Is Going to Hurt. And I'm going to quote Adam Kay: "It doesn't matter how many Zumba classes you attend, unless we address some of the kind of systemic issues, such as workforce shortages, the workforce will continue to experience psychological problems." So there's a reactive approach. So let's say you're a medical student and you develop psychological problems, a reactive approach would be to refer the medical student to a counselor on campus, for example. And the third approach, and arguably the most challenging approach, is instigating systemic change, challenging that culture of stigma and shame that not only permeates medical schools and universities, but also the National Health Service. This is a quote from Dr. Ananta Davi at the Royal College of Psychiatrists. And she said, not only are medical professionals at higher risk of suicide than the general population, but they also disproportionately suffer from the stigma of seeking help. By the way, I have a license to be exuberant. I don't brandish it because that would be a vulgar display of power. And I can also get really passionate sometimes. So don't say I didn't warn you. A survey of over 2,100 female physicians who met the diagnostic criteria for a mental disorder revealed that 50% were reluctant to seek professional help because of fear of exposure to stigmatization. Let that sink in. 50% of female physicians who met the diagnostic criteria for a mental disorder revealed that they were reluctant to seek professional help because of fear of exposure to stigmatization. And if that was physical health, there would be outrage. But because this is mental health, there is a deafening silence. Stigma and a culture of shame are formidable barriers to mental healthcare services. And consequently, many healthcare professionals and students with psychological problems continue to suffer in silence despite the availability of effective treatment. And I have to repeat myself to emphasize that many healthcare professionals and students with psychological problems continue to suffer in silence despite the availability of effective treatment. This is Dr. Miles Christie. He was a GP who tragically killed himself, fearing that he would lose his job if he talked honestly and openly about his mental health. And he is survived by his wife and his 2 children. And this is a statement from his brother, Phil Christie. There is a stigma surrounding doctors and mental health. And I wish that I had the opportunity to meet Dr. Christie, because I would have reached out to him and I would have looked him in the eye and I would have said to him that there is no shame in experiencing mental health problems as a healthcare professional, as a medic, as a human being. And I would have embraced him. This is Dr. Emily Emsin. She was a brilliant psychiatrist with bipolar affective disorder who tragically killed herself and her baby daughter Freya during a psychotic episode. An independent inquiry into their deaths concluded that Dr. Emsin was the victim of stigma in the National Health Service. Mental health related stigma is rampant in the NHS. And if there will be one take-home message, let it be this one. Stigma is killing people. Stigma is killing people. Now is not the time to be quiet. That's why there's a fire burning in my belly and there's thunder in my heart. People are dying. Stigma has been defined by Irving Goffman as a deeply discrediting attribute that reduces the bearer from a whole and usual person to a tainted and discounted one. The individual is thus disqualified from full social acceptance. A deeply discrediting attribute. What is that attribute? It could be mental illness. It could be race. And we know that racism is a huge problem in the global north. It could be your faith. Also, Islamophobia, anti-Semitism, stains on our collective consciousness. And there's a phenomenon, a term in the stigma literature called intersectionality, when you have layer upon layer upon layer of deeply discrediting attributes. So let's say, for example, you are a Muslim man from a BAME background who has mental illness and you identify as LGBTQ+. That is the quadruple stigma. And unsurprisingly, outcomes in that minority group are very poor. The 2008 Stigma Shout survey of 4,000 people using mental health services and carers revealed that healthcare professionals were a common source of stigma reported by people with mental illness. And the most stigmatizing medical specialty? Psychiatrists. Would you believe it? So I was invited to deliver The Wounded Healer as a grand rounds in an Ivy League university in the United States of America before COVID-19. And the cameraman's assistant has no background in mental health. And after I finished delivering my performance, he gravitated towards me and he embraced me. And he said, thank you. Thank you for being you. Thank you for making me feel normal. And then I have a meeting with the head of the Department of Psychiatry, a professor of psychiatry. And when I open my mouth, his face contorts as if I'm about to contaminate him with some ghastly disease. He was disgusted by me. So if I'm in a crisis situation, am I going to go to this self-proclaimed expert who likes to isolate himself in the lofty confines of an ivory tower? Or am I going to go to this cameraman's assistant who dignified me, who empowered me, who, in my most vulnerable, I would confide in because I know that he wouldn't judge me? Stigma is like mental illness in the sense that those who suffer from it are often in denial. How could it be possibly be me? I'm the head of the Department of Psychiatry. And just because I have lived experience, it doesn't mean that I am not a source of stigma. We have to be brutally honest with ourselves, engage in introspection at the level of the individual, and identify any stigma that may be residing within us and challenge it and remove it. And that's my challenge to you, to us all. Components of stigma. Stigma is an umbrella term, and it can be deconstructed into three main components: problems of knowledge, ignorance; problems of attitudes, prejudice; and problems of behavior, discrimination. Now, this is important when you want to operationalize stigma, when you want to conduct evaluations of anti-stigma campaigns, because there are validated psychometric stigma scales in each of those domains. How do we challenge stigma? Through protest, through education, and through contact, and a systematic review and meta-analysis of outcome studies challenging the public stigma of mental illness revealed that the most effective way of reducing mental health-related stigma in adults is when you make contact, social contact, with someone who has recovered from a mental health condition. Why? Because when you meet us, you discover that we have hopes and fears and dreams and strengths and vulnerabilities like everyone else. You discover that we are human beings. And according to the principal investigator, Professor Patrick Corrigan, he argues that experts by experience must operate at the vanguard of any anti-stigma campaign. Nothing about us without us. We can talk on behalf of ourselves. Thank you very much. Here we have Prince Harry interviewed by Bryony Gordon in The Telegraph, honest and open about his experiences living with psychological problems. And mental health charities report that there was a surge in the number of people who contacted them. Mind, for example, state there was a 38% increase in the number of calls they received for their helpline. And so really emphasizing here that we, experts by experience, have the power to reduce mental health related stigma. We need to amplify the voices of experts by experience. However, Prince Harry is an expert by experience, but he's not an expert by personal and professional experience. And my contention is that wounded healers can draw upon both their personal expertise and professional expertise, and that we should be showing leadership in this space, and we're not. We're not showing leadership. And I can't emphasize enough, we must amplify the voices of experts by experience, but they also need to show humility because they are not experts by professional experience. And I listen sometimes to interviews, and some of the content can be not only inaccurate and incorrect, it can potentially be harmful. So we really need to show leadership, and we're not. How do we react to public stigma? We can internalize it and develop self-stigma. And then there's the why try effect. Why should I apply for that post in that university? I'll never get it. I have a mental health condition. Why should I apply for that job in whatever the city? I'll never get it. I have a mental health condition. Why should I apply for the Kennedy Scholarship, for example? I'll never get it. They'll discriminate me because I have a mental health condition. We can be indifferent. We don't care if there is public stigma. And then there's a third group. We become energized. We develop a righteous indignation. We want to be agents of social change. We want to contribute to this cultural revolution, to dignify and empower people with mental health difficulties and to normalize mental health conditions. So many people with mental illness, mental health conditions often have to choose between concealment and disclosure. Now, I'll come back to language because Natalie, I think she's with us today. I want to thank her because she enlightened me, and I'll come back to that. So Coming Out Proud, now known as the Honest, Open and Proud, is a program that offers support with making this difficult decision. And our CT on COP published in BJ Psych revealed that it had immediate positive effects on disclosure and stigma stress related variables. And here it is, Katrina's manual, which I understand she co-produced with Patrick Corrigan in Chicago. And this is actually specifically for mental health professionals with a mental health condition. So far be it from me to impose my approach on anyone. It's a personal choice if you want to share. I have personally found it not only empowering, not only comforting, not only therapeutic, but cathartic. But the question is being honest and open right for you? And if you want to share, what do you share? When do you share? To who do you share? I'm very active on Twitter. Do not go gentle into that good night, but tweet against the dying of the light. It's the digital age, and we need to harness the power of digital technology to contribute to this cultural revolution, to normalize mental health conditions. And we need stories. We need to amplify the voices of expert by experience if we want to reduce mental health related stigma. And so we would have to share. But I can't emphasize enough, it's a personal choice. Here we have Jung. Jung discovered, or described rather, the wounded healer as an archetypal dynamic. It's a phenomenon between analyst and analysand. Now, Jung discovered the wounded healer archetype in relation to himself. For Jung, it is our own hurt that gives us our measure of our power to heal. It is our own hurt that gives us our measure of our power to heal. Now, it obviously defies a single interpretation, but for me, the deeper the wound, the more empathetic a healer you are. Now, of course, you don't have to have lived experience. Of course you don't. You don't have to have lived experience to be empathetic. The point I'm making is it's not entirely disadvantageous. On the contrary, for me, it has conferred advantage. I feel more driven. I'm more insightful. I'm more empathetic. Not only has lived experience made me a better doctor and a better psychiatrist, lived experience has made me a better human being. And lived experience, I would argue, humanizes the psychiatric profession, because we cannot turn a blind eye and a deaf ear to the voices of people who have received care from psychiatrists. Because if you're listening, you will hear that these people are being brutalized by psychiatry. So psychiatry needs humanizing. So when I was a medical student in Manchester University, this is back in 2006, I woke up one morning to discover that my hometown in Lebanon was bombed and that hundreds of people were killed overnight. And my world turned upside down. My nightmare turned into a reality. I saw harrowing and horrific images of dead bodies strewn on the streets of Lebanon. And I didn't know if my family were among the dead. And I reacted. I developed a severe episode of psychological distress. However, debilitating though the symptoms were, the stigma was far, far worse. I was shunned, ostracized, and dehumanized by people who I thought were my closest companions at the time. And in my despair, I contemplated suicide. Fortunately for me, my faith as a practicing Muslim protected me from acting upon these suicidal impulses. So faith deterred me. The Islamic faith deterred me from acting upon these suicidal thoughts. And I survived. I survived. But I was constantly made to feel that I would never recover, that I would never amount to anything in life, that I would be a drain on society. And it is incumbent upon us, mental health care professionals, to instill the seeds of hope into the hearts and minds of people who receive care from us. And I wish that somebody with lived experience could have spoken to me. And I think that's a factor that inspired me to pioneer this anti-stigma intervention. And so, as I said, I was made to feel that we are doomed to underachievement. But not only did I recover, but I also received the Royal College of Psychiatrists Foundation Doctor of the Year Award. And the RC Psych Awards mark the highest level of achievement in psychiatry in the UK. But that wasn't enough. I had been ridiculed and humiliated for so long that I was inspired by my fellow survivors to go above and beyond the call of duty. And I went and I did it again. And this is unprecedented. I'm not sharing this information with you to boast or to brag. That is not my intention. I'm hoping that I can provide you with further evidence to prove that not only can we recover again and function and be the best at what we do, we can make meaningful and important contributions to our society, to our world. And we can be happy, and we can be healthy, and we can realize our dreams. Any anti-stigma intervention must be evidence-based and data-driven. We need to be innovative. We need to pioneer innovative anti-stigma programs. We have a story. What do we do with that story? We speak with the experts. And I have a lot of respect for Professor Sir Graham Thornycroft at the IOPPN. And he said, read this paper, Ahmed. I met him at the World Psychiatric Association World Congress in Berlin. This is a paper by Stephanie Knack at the University of Calgary, the key ingredients of anti-stigma programs targeting healthcare providers. And as will be revealed, the Wounded Healer anti-stigma program contains 4 of the 6 key ingredients. And it's been described as an innovative method of teaching that blends the power of the performing arts and storytelling with psychiatry. The argument we continue to make is, how can you educate an audience if you can't engage them? So I, for example, rock up in Greenwood Lecture Theatre at King's College London, and the auditorium is heaving with 350 medical students. And I kid you not, there's a brother, a young man from a BAME background. I don't know why he sat in the front row, because he's sleeping and he's snoring and he has saliva drooling down his face. And some of the other students are thinking, oh no, here we go again, death by PowerPoint. So I galvanized my audiences by reenacting scenes from famous films. Pulp Fiction, Ezekiel 25:17, the path of the righteous man is beset on all sides by the iniquities of the selfish and the tyranny of evil men. Now blessed is he who, in the name of charity and goodwill, shepherds the weak through the valley of the darkness, for he is truly his brother's keeper and the finder of lost children. And I will strike down upon thee with great vengeance and furious anger those who attempt to poison and destroy my brother. And you will know that I am the Lord when I lay my vengeance upon thee. And I actually delivered it with more gusto, because towards the end, when I'm on that stage, I'm beating my chest. And if the people are not freaking out and they're not engaged by that scene, I don't know what will galvanize them. And it's delivered by a wounded healer. So I draw on both my personal expertise and my professional expertise, because once they are entertained, once they are engaged, that's when we can educate them. And that's when we can equip them with the tools and the knowledge to challenge stigma. And I collaborated with medical school psych socks. I tapped into that resource. I repeat, I tapped into the resource of medical school psychiatry societies throughout the UK. And I got feedback like this, which inspires you, because I have encountered resistance. There are senior psychiatrists, and I won't mention any names. There are senior psychiatrists who claim to be active against stigma, and yet when I think about them, I feel dehumanized by them. And I'm grateful to them, because I don't ever want to make anyone feel the way they make me feel. And I'm sure there's some unprocessed trauma somewhere. But this inspires me to continue with our campaign. I've delivered it to over 75,000 people in 18 countries and 5 continents worldwide. How are we doing for time? Oh, we're okay. I delivered it in Portugal, the University of Coimbra, the cross-cultural impact of the Wounded Healer. Like I said, this feedback inspires me to continue with my campaign, because I mean, the feedback has been overwhelmingly positive. But as I said, I do encounter resistance, and it can demoralize me sometimes. So really great to receive this feedback. So Sarah Evans-Lacko, bless her, my supervisor at King's, she conducted this multi-institutional study. And participants, nursing students, were allocated to one of 3 arms: an informational leaflet, a short video, or a seminar involving direct contact with a service user. This is the language they use. I personally wouldn't use that term. Effect sizes at follow-up were vanishing in the firearm, medium in the seminar arm, and small in the video arm. And seminar, unsurprisingly, had the strongest and most stable effect. But the effect of short video interventions was also considerable and stable over time. And so they conclude that since short, effective video interventions are relatively cheap, conveniently accessible, and easy to scale up, easy to disseminate globally, we recommend them for future research and development. So initially, I was reaching out to medical schools, psychiatry societies, med schools, psych socs, because nobody heard me. This is back in 2014. Nobody heard me and nobody heard of me. But now I'm really fortunate because I'm inundated with invitations, but there are only so many talks that I can give. And it's also, I mean, it's rewarding, but it's also exhausting. And initially it was pro bono. I was paying out of my own pockets because there's stigma attached to research on mental health stigma. So nobody, I mean, now everyone's saying, oh, wow, you know, this is amazing what you're doing. But way back when, I think this is back in 2014, it was different. So, as I said, inundated with requests to deliver the Wounded Healer. But there are only so many talks that I can give. So we digitized. We created the Wounded Healer film and we digitized it. And so now we can scale this up and hopefully reach out to as many people as possible. This is a fascinating study conducted by a dear friend of mine, Professor Andreas Martin at Yale School of Medicine. And it was a randomized trial of an intervention comprised of 2 wounded healers. And the outcome measures they used were the ATP and the AMI, which respectively attitudes towards psychiatry and attitudes towards mental illness. So they didn't use a validated psychometric scale on stigma, but nonetheless, their findings were very interesting. And the participants in the active group had more favorable attitudes on ATP and AMI scores as compared with the control group. And 91% of respondents endorsed the statement that knowing physicians further along in their careers who struggled with mental health issues, who got treatment and who are now doing well, would make them more likely to access care if they needed it. But this was after my study, but I thought I would just mention it here. Okay, so we spoke about language, and naturally once she engaged with me on Twitter in a very constructive, polite, respectful way. So the criticism was constructive as opposed to destructive. And it's a beautiful quote. I love my movies, and this is one of my favorite movies, V for Vendetta. So whilst the truncheon may be used in lieu of conversation, words will forever retain their power. Words are the means to meaning, and for those who will listen, the enunciation of truth, the power of language. And so this paper here, the term that Andreas uses is disclosure. And so he sent me, when I contacted him, and then he invited me to deliver a grand rounds at Yale, and I had a chat with him, and I said to him, you shouldn't use the word disclosure because it has criminal connotations, right? And there's nothing criminal about sharing. And the person who said that to me was Natalie. So thank you immeasurably, Natalie, because thanks to your intervention, Andreas published this paper, and he used the term shared instead of disclosing or disclosure. So power of Twitter, power of communication, and a reminder of the importance of language. And this paper, they conclude that sharing histories of personal vulnerability by senior physicians can lessen stigmatized views of mental health and normalize help seeking among medical students. The power of embracing your vulnerability. So this is a paper published by Haritha in BJ Psych Bulletin. Haritha, she received the Medical Student of the Year award from the Royal College of Psychiatrists, and she was president of KCL PsychSoc. So this is actually incorrect because I've been tapping into PsychSoc's, the resource, for many years now, and they actually cited 2 of my papers in this editorial. And so I collaborated with KCL ISOC And Professor Jamie Hackett Hughes, a former president of the British Psychological Society, friend of mine, very honest about his experiences living with profound oscillations in mood, bipolar affective disorder. And this study had all 6 key ingredients identified by Stephanie Knack and her team at the University of Calgary to challenge stigma among healthcare providers. And we conducted a single-arm pre-post comparison study. We had a 100% response rate. Everyone who attended the event, they were invited to complete these validated psychometric stigma scales of knowledge, attitudes, and behavior before and after exposure to the event. And this is for knowledge, and you can see there is a statistically significant reduction in stigma. So the higher the score, the lower the stigma. So this is for behavior, reported and intended behavior, RIBS. Again, statistically significant. And this is for attitudes. Again, you can see the p-value there. So this is actually the first intervention study. So this is published before Andreas Martin at Yale, and now we are collaborators now. We're working on another project, which is something we're really excited about. So first intervention study to challenge mental health related stigma comprised of wounded healers. It was associated with significant improvements in scored in all 3 stigma domains, and it contained all 6 key ingredients. So we argue that wounded healers can harness their trauma to help harmonize relations between providers and receivers. And I spoke about how receivers of psychiatric care report that they feel brutalized, and there's this huge gulf between providers and receivers. And maybe wounded healers can harmonize relations between the 2 camps, and we can humanize psychiatry, because psychiatry needs humanizing. It illustrates the colossal power of wounded healers. However, it's fraught with limitations. It was there was no control group, small sample size. So yeah, more research in this area needs to be done. Now, I'll finish with this fascinating study published this year in the British Journal of Psychiatry in May. So as I'm sure Professor Greenberg mentioned, many healthcare workers do not seek help despite their enormous stress and greater risk for anxiety, depression, and PTSD. And as I said, my mental health took a real battering during the pandemic. But despite the availability of effective treatment, we continue to suffer in silence. We're not seeking help because of the shame, because of the stigma. And so this study aimed to evaluate the efficacy of a brief, and by brief, how long do you think it takes to reduce stigma or to encourage care seeking? 90 seconds. No, sorry, 120 seconds, sorry. A very brief video, and the protagonist is a healthcare worker. And I'll discuss, I'll describe the intervention. So the study aimed to evaluate the efficacy of a brief social contact based. Now it's social contact, but it's virtual contact. It's not face-to-face, but still the data emerging from the studies is showing that actually the difference between the 2, and as Sarah Evans-Lacko's study showed, the difference between the 2 isn't so big. And so 350 healthcare workers were randomized to a brief video-based intervention coupled with a booster video. Then there was the video at day 1 only, or a non-intervention group. This is the intervention, 120 seconds. Female nurse, protagonist, described difficulty coping with stress, her anxieties and depression, barriers to care, and how therapy helped her. And so the brief video-based intervention yielded greater increases in treatment-seeking intentions. That's all it took, 120 seconds, than the control condition, possibly through identification and emotional engagement. This is really important. We need to be able to identify with the protagonist and engage. There needs to be an emotional engagement. And also, we need to humanize the condition, because the same principal investigator conducted a study on challenging the stigma attached to first episode psychoses and revealed that a 90-second video-based intervention was enough to reduce the stigma. Sustained reductions published in the American Journal of Psychiatry. And so what's really important, again, is to humanize the condition, identification, and emotional engagement. And you can only achieve that with storytelling. You cannot achieve that with, in my opinion. You need to harness the power, and that's why experts by experience should be operating at the vanguard of any anti-stigma campaign. And we can scale this up. Take-home messages. It's okay not to be okay. There is no shame experiencing mental health problems as a healthcare worker. Seeking help is a sign of strength. It's not a sign of weakness. And effective treatment is available. And recovery is a reality for the many, not for the few, not for everyone. We can't misinform people. And our hearts go out to those who have serious mental illnesses, because we are not doing enough for these people. But recovery is a reality for the majority of us. And of course, lived experience is a superpower. Thank you.